There it is. That's the red light. I think we're live.
Hello everyone and welcome to Taming Your Flame, and today we're going to be talking about your immune system and how supplements and herbs are a big part of that.
Because the immune system has a big play in chronic inflammation.
Right.
And we know that chronic inflammation is the precursor to
All
disease.
chronic diseases.
All chronic disease. So we have to get a handle on this chronic inflammation. We just have to. And it involves the immune response. So having a strong immune system is very important. And we really want to talk about the ABCDs zinc. ABCD zinc.
Yep.
And
So one of the things that have been in the news is everyone is concerned about this coronavirus.
I've heard about that.
Yep. And one of the things that you and I have found about that is they're linking vitamin D deficiency to the coronavirus. It may be a way to treat it.
It may be that people that have had or are having the hardest time are also those people with the lowest levels
Right.
of vitamin D.
So here's a recent article that came out, and it talks about vitamin D deficiency and the severity and mortality of people who are lacking in vitamin D. So
Right.
the research is coming out. Here's another one that just came out talking about, vitamin D. So how much of this vitamin D do we take?
Well, we know from past medical research and even now some of the more medically relevant news that vitamin D is extremely important for the immune system.
Right.
And to get our levels into that optimum level,
Which is
50 to 60, I test mine once a year. Last time I tested it 3-4 months ago, it was 86.
Okay.
So I take 5,000 units a day. I think that's reasonable for most
I do
people
too, right.
to begin, because most people that I check are down in 20, 25, 30, 32, 30. I mean, that's way too low.
Right.
So to get it up, you need to be 5,000 units,
Sure.
international units a day.
Sure.
And the beautiful thing is vitamin D3 is inexpensive.
Right.
It's almost, I might even argue, the best value, nutraceutical value on the market.
Sure. It's very inexpensive. So it's not cost prohibitive.
No, it isn't.
So even people who are on retirement, as you
Even
are,
people that on retirement.
can afford vitamin D.
Exactly.
So no excuse not to take your vitamin D.
No, and it's too big to miss, really. It's really more of a hormone. You've
Yeah.
said that before.
Yep.
And we've kind of talked about that. It really functions more as a hormone. It has the same chemical structure as all of our sex hormones,
Yes.
with a cholesterol backbone, if
Yeah.
you will. So that's interesting.
Now, another one you had mentioned is vitamin A, which affects the mucous membranes.
Exactly.
And lungs.
And the lungs. I mean, it's huge for the lungs.
Yep.
It's huge, Caroline,
Yep.
for the lungs.
Yes.
Respiratory tract. The mucous membranes. This is a big deal. You don't think about it much. But tears, saliva, the mucous membranes, that's our first line of defense.
Sure.
And who's important in the health, the nutritional biochemistry of those tissues? Vitamin A.
Vitamin A. Yep.
So 15,000 units a day,
Yep.
más o menos.
Yep.
Okay, that's sufficient. Then vitamin C.
C is important.
For the immune system. Since the days of Linus Pauling,
Yes.
we have medical documentation on the effectiveness of vitamin C in a strong immune response.
Right. Now, how much should we take?
The research, it's interesting. That's a very good question, and my recommendation is 1,000 milligrams a day. It's doable. Vitamin C is not expensive either.
No.
And a vitamin C molecule is a vitamin C molecule is a vitamin C molecule, pretty much. There are some mineral ascorbic acids
Right.
that I think have benefit because of the GI. And you're somewhat draconian in your measure with your customers and patients, taking them to a certain level.
I tell them to increase their vitamin C until they start feeling kind of gastric distress. And then
Well, that's nice of you, Dr. Skull. Here, Mrs. Smith, I want you to, here's to your gastric distress. Is that okay?
Yeah.
And then what happens? So you have a level at which you have gastric distress,
Right.
bowel tolerance, diarrhea, and
Yeah.
then you what? Pare them back from that amount.
Correct, and that would be the level that they need at that point in time.
Okay.
Yeah.
Okay. Well, that's one way of finding out the level.
Sure.
Okay. So that's the vitamin A, 15,000 international units. Vitamin C, 1,000 milligrams. Vitamin D, 5,000 international units.
Yeah.
B vitamins, the A, B, C, D, zinc, and so we both recommend basically a multiple vitamin
A
mineral.
multivitamin, and as you and I had spoken, be careful, be aware that your urine will change color.
There you go.
It'll be bright yellowish because of the B's or water soluble.
But that's a warning, or not a warning.
No, just a FYI.
It's completely harmless.
Yeah,
it's
it's
just you're excreting the B vitamins.
Yeah, but patients freak out when they first see it. They're
Right.
like, oh my God, I'm going to die.
I'm gonna die.
So I tell them in advance, you'll see that, don't be concerned.
You're not gonna die.
No,
Okay.
not from
Not
from the B's.
Okay.
Maybe from the vitamin C.
Oh my heavens.
Yeah.
So we have the A, B, C, D's, zinc.
Zinc.
So that's really a nice, I don't know, it sounds like a good recipe for immune system maintenance.
Yep.
Just nutritional biochemistry to maintain those particular tissue types.
Yeah. And then we get into the herbs that I use in practice.
Right.
I use turmeric, boswellia, and fish oil. Not together, but separately.
Right.
Testing patients to see which one works best.
Well, start with the turmeric, Dr. Scone, if you would, please.
The chemical in that is turmeric is the spice, curcumin is the chemical,
Mm-hmm.
and it's a good natural anti-inflammatory.
That's the orange colored?
Right, and you can use it in cooking too. You can
Okay.
sprinkle
Yeah,
it in food.
that's
That's very
where-
expensive,
Oh,
So we'll
It
take
is.
it in the tablet
the
form.
frugal Norwegian isn't gonna cook so much with it then.
No,
But you Italians cook with everything.
No, we don't use turmeric though.
Oh.
That's not one of ours. It's more of a Middle East spice.
I see. So you take it in supplement form?
I do. I take it in a pill form. I take 500 milligrams daily.
Okay.
If I have an acute flare-up, let's say my knee hurts
Mhm.
my shoulder, I'll increase that until that symptoms diminishes, and that would be your baseline again.
So 500 milligrams when you're feeling some symptoms,
Right, or more.
or more, and then proceed accordingly with your symptom apparently relief.
Right,
Okay.
right.
Okay.
And boswellia would be the same. Some people, if you don't see a response with the curcumin, switch to boswellia.
Okay.
Or frankincense, which is the same thing, boswellia, frankincense.
That's where I was going. Frankincense.
Frankincense.
Yeah,
Yeah,
this is a biblical herb.
it's been around forever.
Forever.
Yeah.
Forever.
And same thing with turmeric, it's been around a long
Okay.
time. It's again, a Middle East spice that they
Right.
use a lot. And the last thing is the fish oil, which is really good.
You
know,
can't forget the
omegas.
fish oils, the omega-3s.
Yep,
EPA, DHA.
yep. The only word of caution here is when you do take those herbs, if you have to have any surgical procedures, back off for a week
Okay.
because they're blood thinners.
Blood thinners.
Right.
Okay.
So you may notice that the blood pressure will go down too.
Right.
You may not need to take as much blood pressure medicine when you're on those
Mhm.
supplements.
In keeping with the turmeric, boswellia, and then the cooking part that I get interested in because I love to eat,
Right.
basil,
Basil, sure.
rosemary,
Yeah, all the fresh spices.
ginger. I
Sure.
mean, these are powerful anti-inflammatories and depots of phytochemicals, which we don't talk about that a lot.
Yep.
They don't get a lot of PR, but they're involved in chemical reactions all day long.
Yep. So those are things you want to add. Now we speak about that more in our classes, in the 5 classes that are coming up.
We dive down pretty deep in the 5 classes on
Yep.
this, but this at least gives you a bit of intro.
Starting point, yeah. And that should be coming online very soon, within maybe, hopefully by the end of this month.
Yep.
And so look for that. And our next topic that we'll be speaking about is stress.
Let's look at stress and the cortisol response and that area's effect on the immune system.
Right.
Stick
So-
with the immune system for a while.
So that'll be coming soon, and look for that. So
All
we'll
right.
say goodbye for now, and hopefully you like us, subscribe, and tell your friends.
Bye for now.
Bye now.
See